Good morning, everyone, and thanks for the opportunity to talk today about depression and anxiety in older people. I'm going to start with an apology because, like half of Melbourne, I have a bit of a lurgy, so if I'm spluttering away, forgive me. What I want to talk about is what depression and anxiety looks like in older people and what are some of the risk and protective factors for depression and anxiety. So what is depression? Depression is feeling sad, down or miserable, lacking interest or pleasure. Has anyone ever felt like that? A show of hands. We have all felt that, haven't we? But the thing about depression is that it's a sustained feeling and it lasts for at least 2 weeks or more, and it is different for different people. And normally what happens is that you have symptoms across 4 categories, and I'll have a look at some of these categories now. So there are symptoms from the feeling category, so you can feel indecisive, overwhelmed, lacking confidence or irritable. So you've got that feeling of lacking pleasure or interest. It's sustained for 2 weeks or more, and then you'll have symptoms from some of these categories. And for a diagnosis, you'd normally have to have symptoms from at least 3 categories. Physical categories, you've got tiredness, disturbed sleep. What do you think might happen if you have depression? What might happen to your sleep patterns, do you think? Disturbed sleep? Difficulty getting to sleep, perhaps? Waking early, and that's the real sign of depression, that waking early. There's also sick and run down and appetite changes. And for a lot of people, they'll have a real loss of appetite and they'll lose weight. There can be symptoms from behavioural categories. So social withdrawal, difficulty concentrating, and alcohol and other drug use. And the last one there is thinking. So you can have very negative thinking patterns, feeling hopeless and worthless. And I often describe this as a negative whirlpool. So, you might think that you're no good at one thing, but you extend it to everything. So I can't do anything. So real themes of hopelessness and worthlessness. And that can lead to suicidal thoughts. So there's a real link between depression and suicidal thoughts. So depression in older people. So I often ask people, is depression in older people the same condition as it is at any other age? Do you think depression is different if you're an older person? You do? What do you think is different about it? Said with confidence, yes, but I can't hear the answers. Yes. Yep. The feelings emerged, yes. Okay. So you had that in your 30s. Did you have depression as an older person as well? No, okay. All right. No. And look, actually being employed is very good for your mental health, But essentially, depression is the same condition as an older person as it is as a younger person. The presentation can be slightly different, so there can be some symptoms which are more accentuated than others in depression in older people, but essentially the condition is exactly the same. So what you find with depression in an older person is you often find there are more symptoms from the physical category. You know how I was showing you those 4 different categories? Well, you'll find there's more symptoms from the physical categories than from the other categories. So you'll have reports of pain and multiple physical symptoms. The person will be sick and run down. They'll go to their doctor complaining of migraines and not being able to sleep, rather than reporting that they're feeling really sad and down. So yes, more symptoms from the physical categories than any of the other categories. There can be reports of memory problems, which is problematic for older people because, of course, with dementia, people can have problems with memory as well. So sometimes it can be difficult to discern what's actually going on for this person. There can be substantial weight loss for older people. And they often use different language, so they might talk about their nerves rather than their mood or sadness. But overwhelmingly, they're less likely to talk about sadness, and they're more likely to go to their GP with those complaints from the physical categories. So what is anxiety? Anxiety is more than feeling stressed or anxious. The feelings can be very difficult to control and it can be overwhelming. Now, if I were to stop now and ask some of you to come up and talk to the group, you might start to feel or experience anxiety, mightn't you? And what might that be like? Someone said sweating, palpitations. Do you think you'd be paying attention as everyone else gets up here and says anything? No, you won't be concentrating or paying attention. What you're experiencing is anxiety. For an anxiety disorder, it has to be very sustained, and also once the anxiety-provoking event is over, so once you've come up here and you've done a stellar performance and you go back to your seat, what happens? The anxiety goes away. But for a person with an anxiety disorder, they carry those feelings around all the time. What do you think that might be like? Completely overwhelming. You can't turn off it to go to sleep. So unlike depression, where the person might have early waking, with a person with an anxiety disorder, they may never be able to get to sleep. So they've got that CD going over and over in their head. They're rehashing conversations and memories that they're worried about. So, but like depression, the symptoms can occur over those 4 categories as well. So it's similar to depression. So you can see here with the feeling category, there's sudden, intense panic. They're feeling overwhelmed, fearful, irritable. Physical, sweating, difficulty sleeping. As I said before, they'll have trouble turning off from their thoughts. Muscle pain. Sometimes people think that's an odd one, muscle pain. But what that actually reflects is that when you're tense or anxious, what happens is that you tend to hold your body very tightly. So you'll have tension and you'll have muscle aches in your neck and your shoulders from the anxiety. And you'll be restless and on edge. Oops, going the wrong way. Behavioural, social withdrawal. Why would I put myself in a position where I'm going to experience more anxiety? So you'll withdraw from those social events that might make you feel more anxious. Poor concentration, and again, alcohol and drug use, and that can be to manage the symptoms that you're experiencing. And thinking, so constant worrying, recurring and obsessive thoughts, never being actually able to turn off from those thoughts. Every conscious moment is, concentrating on some previous conversation or some thought that you're worried about. So the types of anxiety and stress disorders, similar to depression, but anxiety disorders actually represents a range of different conditions. So there's conditions like generalised anxiety disorders, there's specific phobias. You might have heard of obsessive compulsive disorder. These are all anxiety disorders that have their own clinical criteria. And Beyond Blue has fact sheets on all of these anxiety disorders to give you more information. Social phobias, post-traumatic stress disorders. Yes, so there's a range of some of the anxiety disorders. Anxiety in older people. Generally, anxiety has been less researched over the entire population, but particularly in older adults as well. It can be situation dependent, so there might be a particular trigger for the anxiety for the person. And unlike depression, anxiety in an older person is often more easily recognised because they'll have symptoms such as they're very fearful, they're agitated, they're complaining of sore muscles, and it's obvious that they have multiple worries. And a really good indication is a past history of an anxiety disorder. It's probably fairly uncommon for a person over the age of 65 to develop a brand new anxiety disorder. It's much more likely that they'll have had a history of anxiety. And if anxiety presents for the first time over the age of 65, it actually might be a symptom of depression rather than anxiety. That was true for my father. He developed depression, and the overwhelming symptoms that he had was this real anxiety, and it was actually a symptom of his depression, not an anxiety disorder. Okay, we'll just look at the incidence. And I can always tell if Beyond Blue's done a good job. How common do you think depression is in the general population? 20%, someone said. That's pretty close. 1 in 5, someone said. That's close too. So if you think about depression and anxiety, which would be more common, anxiety or depression? Anxiety. Well, you're right, actually. Depression's 15%. Anxiety is 26%. So that's your lifetime risk of depression or anxiety. Now, of course, my area is looking at older adults in the community and older adults in residential care. So the incidence of depression for older adults in the community is anywhere from 10 to 30%. And basically, if a person is frail and needs significant supports to remain at home, they will have double the depression prevalence rate than their well community counterparts. And for anxiety, it's 26.2%, so similar to the general prevalence rate. If we look at older adults in residential care, I wonder what you're thinking there. Higher or lower? Higher. Someone said lower. A couple of people said lower. This is Australian research that showed 34.7% of people in residential care have depression, so 1 in 3. And anxiety, unknown, but believed to be higher. So generally, anxiety across the board, there's higher prevalence rates than depression, and we believe that's true for people in residential care as well. Now, this may not be something you're aware of, but older men over the age of 85 have the highest suicide rate in the population. I'm talking about rate here, not numbers. So if you look at a bell curve from the ABS, you'll see that it's quite high. This is for men. It's quite high in the middle years, and then the highest in those over 85. And the next highest group is in those between 80 to 84. If you look at women, women have a lower suicide rate, 3 to 5 times lower than men, but the highest suicide rate is in women between the ages of 80 to 84. And of course, we know the link between depression and suicide. Not saying that all people with depression will have suicidal thoughts, and certainly not all people who suicide have depression, but there is a link between depression and suicide. Risk and protective factors. I often talk about risk and protective factors for depression and anxiety. And this is very similar to cardiovascular disease or diabetes, any physical health conditions. We're very familiar with the concept of risk and protective factors. So, you know, there are certain risk factors for diabetes, for instance. There's things like obesity, poor diet, lack of exercise. They are risk factors for developing diabetes. And there would be protective factors, things like seeing your doctor regularly and getting good exercise and having a good diet. They're protective factors. So we can use the same concept when we think about our mental health. So looking at older people, the risk factors are grief and loss. Older people have a 9-fold increased risk of depression post a loss. Chronic illness, there's real links between chronic illness and depression and anxiety. And of course, as you get older, you're likely to experience more chronic illness, chronic pain. Being a carer is a risk factor. I mean, being a carer supporting a family member is a risk factor for depression and anxiety, and changes to living situations. So moving into residential care, for instance, is a risk factor. Another risk factor there, it sort of probably falls under chronic illness, is dementia. Dementia is a significant risk factor for depression In fact, the most significant depressions that occur in residential care are in people with dementia. It's complicated because it's very difficult to detect depression in people with dementia. So there's some of the risk factors. So what are some of the positive things? Social connectedness. Being more socially connected is very good for your mental health. So, you know, coming along today, being involved in various groups, that's very good for your mental health. Lifestyle, diet, exercise, these sorts of factors are very positive for your mental health. The important thing to realise is that effective treatments are available. There's a range of treatment options: drug, psychological, lifestyle. Exercise is actually a treatment option for mild to moderate depression. So effective treatments do exist, but unfortunately 75% of older people don't seek help, as opposed to the general population where 50% of the general population don't seek help. I just wanted to finish with just talking a little bit about what Beyond Blue provides. And we've got an excellent website, we've got a support line, we have a range of fact sheets, DVDs and booklets, and some of these are specific to older people. So we've got a booklet, Depression and Anxiety in Older People, and actually in your bag today you will have a couple of examples of Beyond Blue publications that are aimed at older people. I've got a great booklet called Over Bloody 80, OBE booklet, which looks at what older people do for their mental health, and some of those stories are inspiring. The last thing I wanted to finish with is just to let you know that Beyond Blue has been working with the National Australia Ageing Research Institute, NARI, and we're doing some work with carers. And we are looking to recruit a carer and a person that carer is supporting for this particular research. So I don't know if many of you would fall into that category, if you would know anyone who might fall into that category, but it would be great as we are currently recruiting for that study. And it's around designing exercise and activities that are appropriate for the care recipient and the carer. So I've got some flyers about the research today, if anyone is interested, and I'll just leave them at the front of the dais, if that's all right. Okay, thanks for that.
Well, thank you.